Okay, here we go. Okay. This presentation reports on the findings of the 2024-25 National Neurology Patient Experience Survey in Scotland, focusing on individuals with neurological conditions and their carers. This is a Scotland-wide overview with insights drawn at health board level where possible. My aim is to keep this to 20 minutes and we'll have questions afterwards. And again, this is mainly drawn from the quant data and I've added insights from the open-ended questions for context. Following a tender process, an agency called Revealing Reality was selected in 2024. We used a methodology of surveys distributed by clinics and available online, collecting data from adults and children with neurological conditions and their carers. Fieldwork was open from the 27th of August till the 15th of November 2024. Before fieldwork started, we reached out to all the neuro clinics in Scotland by email and followed up with phone calls to encourage engagement. Despite this, our clinic engagement was low, with just responses coming in from 2 clinics for adult respondents and 2 clinics for child respondents. The majority of our respondents took part through links they'd seen shared online. NAUS is an umbrella organisation of around 45 charities working across 32 neurological conditions, with 10 or so charities offering pan-neurological services. So that means that the charities with the more actively engaged audiences were more successful in getting a good response rate. We achieved a total of 1,013 responses. This is an increase in our responses from the previous iteration of the survey, and it's because we opened up the new carers survey. We had 776 responses for adults, 67 for children and young people, and 170 for carers. The carers survey was split in half, so people could share their own experiences caring, and if the person they had cared for had not done the adult or child survey, then the carer could also answer that on their behalf. As you can see, we had a disappointing response from children and young people with only 11 responses, so the majority of insights in this presentation come from the perspective of the carer. We were pleased to receive responses from all 14 health boards, although Orkney and Shetland only had a few respondents each. We would like to note the relatively high number of responses from Western Isles, which is in part due to the work of one of our trustees who runs a charity called Neuro Hebrides and who is very active in encouraging their community to be involved. In terms of demographics, 2/3 of adults were aged between 45 and 74, 99% described themselves as white, British, Scottish, Irish or Welsh, and nearly 3/4 were female. In terms of education, just under half the sample was educated to degree level or postgrad level. There were 2 sources of information on the CYP experience, the 11 responses we had from children themselves, and 56 responses from carers on behalf of children. There was more of an even gender split here, with 52% female and 46% male, and 2% who think of themselves in another way. Again, the majority were white, British, Scottish, Irish and Welsh, and there was an even spread of ages between 0 and 17, with slightly more responses for older children. For carers, the majority were aged between 35 and 74, and most carers are spouses, partners or parents. The data highlights significant challenges faced by adults living with a neurological condition. 1/5 of our adult respondents had ME, and another 1/5 had FND. This is a doubling of the proportions of people with ME/CFS from the previous iteration of our research, and perhaps is one of the impacts of the COVID pandemic. It's important to bear this in mind as the impact of living with a difficult to diagnose and fatigue-causing condition comes across in these results. Over half the adults have been living with a neurological condition for over 5 years, and many people are living with either physical or mental health comorbidities. This chart shows all the conditions that were captured in the survey. The 10 most common conditions are covered here: Alzheimer's, dementia, brain cancer, epilepsy, migraine, MS, Parkinson's disease, cerebral palsy, and stroke. This isn't dissimilar to the condition samples we had in the last iteration of our survey in 2022. We're concerned to see that the majority of respondents say their condition makes it difficult to cope with life. Looking at everyone who reported impacts ranging from somewhat to very much, the biggest areas are fatigue, movement difficulties, and poor sleep. These three areas had the biggest proportions of respondents reporting a severe impact, which subsequently impacts activity levels and ability to complete daily tasks. Other major impacts are on mood and mental health, and thinking and memory, both of which impacted 3/4 of respondents, and pain, from which 2/3 suffered. The economic impact was stark, with over half the respondents having had to give up work due to their neurological condition. Reasons for this range from progression of their condition to the point that work became impossible, but also discrimination at work or employers not putting sufficient measures in place to enable people to stay in employment. This has had a big impact on people's ability to manage financially. Over half our respondents did not feel supported by the health system, and nearly half say it's not meeting their needs. A lack of available support was a clear reason for people feeling isolated and unable to cope. People also reported not being given enough information about their condition, but those who had received it rated it highly. Difficulties accessing follow-up appointments and not knowing who to contact for support between appointments is perhaps one of the reasons for a fifth of respondents having unplanned or emergency hospital admissions over the past 12 months. From the open-ended comments, we know some clinicians do not follow the NICE guidelines for conditions like ME, which are advisory, not mandatory in Scotland, and the lack of services for adults with cerebral palsy might also be a contributing factor, along with those having irregular health checks and perhaps not having a consistent healthcare professional. The largest source of support for adults with neurological conditions is from family and friends, with a minority agreeing they don't need support at all. Lack of awareness of available support is the biggest barrier to access. Looking at support by health boards, respondents from NHS Fife were the least aware of what support is available to them. Access to healthcare services is one of the major barriers for people with a neurological condition. Experiences of long waiting times to get a diagnosis causes additional anxiety and stress, and long waiting times to get a diagnosis occurred particularly for those with essential tremor, dystonia, and fibromyalgia. Access to neurologists, orthotics, and scans was taking more than 2 years for around a tenth of our respondents. People are frustrated that the healthcare system determines who they can and can't get access to, rather than referring them to services which might help their symptoms. The hardest services to access over the past 12 months have been neuropsychiatry, respite care, and inpatient neuro rehab. The need for respite care came up frequently in the open-ended responses. Over a third of respondents are unhappy with their healthcare provision over the last 12 months, but a fifth agreed it had improved over the last 12 months. Let's look where we have the happiest respondents over the next few slides. Bear in mind the low number of responses we had from Orkney and Shetland. Satisfaction was highest for medical and healthcare services in Western Isles, Forth Valley, and Lothian. Generally speaking, a third of respondents from all health boards were well satisfied in that they strongly agreed with their medical and healthcare services meeting their needs. Generally speaking, between a fifth and sixth of respondents were satisfied with government-provided personal and support services, which is social care across all boards. Highest rates of satisfaction came from respondents in the Borders, Western Isles and Forth Valley. However, as one of the quotes says, the quality of social care depends on the assessment taken by the social worker, which is where raising awareness of neurological conditions amongst social workers is so critical for people. Another person makes the case for paying care workers in accordance with their importance to society. Perceptions of improvements to medical and healthcare services over the past 12 months were shared only by around a fifth to a third of all respondents from health boards, with the exception of Borders and Ayrshire and Arran, where respondents' perception of improvements was less positive. Highest perceptions of improvements came from respondents in Forth Valley, Highland and Dumfries and Galloway. Perceptions of improvements in personal and support services over the last 12 months were variable, with it felt mostly in Ayrshire and Arran, Grampian and Highland. Orkney scores well here as well, but we note we only had 3 respondents from this health board. We were pleased to see an improvement in interactions with healthcare professionals since our last survey in 2022. Receiving a diagnosis is often life-changing, and accurate information about the condition, common symptoms, medication and prognosis are vital to ensure the individual is a partner in their care and support. In the last iteration of the survey, a third of adults were leaving the consultation without any information about their condition. Whilst we didn't ask this exact question this time, we can see that well over half the respondents agree that healthcare professionals explain medical information clearly and in a way that they understand, which feels like a big improvement. Relationships with healthcare professionals are also positive, with the majority of respondents comfortable talking to healthcare professionals, and over half are happy with the appointment format. But getting follow-up appointments can be tricky. On appointment format, it's worth flagging that some of the open-ended responses were frustrated with format, for instance, where people are bedbound and unable to access home visits from their GP, which meant they couldn't get access to services unrelated to their condition, such as smear tests or blood tests. A few people spontaneously mentioned having noise sensitivities and so being unable to cope with telephone appointments either. In 2022, 80% of adults said their neurological condition negatively impacted their mental health. This has now increased to 87%. Over a third of respondents talk about having a mental health comorbidity like generalized anxiety disorder, anxiety, clinical depression, OCD, and so on. A third of respondents disagreed that mental health services are meeting their needs, and over 1 in 3 have no one to talk to about their mental health. Waiting times for counselling are far too long, and access to neuropsychology and neuropsychiatry is difficult, with a third of respondents still waiting. However, the majority of respondents confirm that counselling does meet their needs. This tends to be where people can access condition-specific insights and coping techniques, and where the counsellor has a knowledge of their condition. Let's look at satisfaction with mental health services by health board. Respondents from Borders and Western Isles had the highest levels of satisfaction with mental health services. Those from Ayrshire and Arran and Lanarkshire were the least satisfied that these services were meeting their needs. In the open-ended answers, we're reading about people failing to get adequate NHS support in time, leading to an exacerbation of their symptoms, and then being told their mental health is too complex to be managed and having to go privately. People are also paying to go privately where there are no mental health services available for their condition. Another common theme is the development of a mental illness, such as anxiety and depression, due to the long waiting times to get a diagnosis. For those who have a condition without a pathway, or where there is a pathway they can't access, or where there are no adult services or treatment, there is a strong sense of isolation and having to cope by themselves, which leads to growing anxiety and fear. This is where peer support groups can be very effective and are often seen as a lifeline. We had variable data on perceptions of improvements in mental health services over the last 12 months, with the strongest perception of improvement coming from those in NHS Fife, followed by Lothian and Tayside. Very few people noted improvements in mental health services in Ayrshire and Arran, Dumfries and Galloway, or Western Isles. As previously mentioned, the majority of patients are now comfortable talking to their healthcare professional and raising mental health concerns with them. The majority are happy with the appointment format, although this doesn't mean that everyone is happy. Some people have had a good experience, but consistency in care was also flagged, with nearly half the respondents noting they struggle to see the same healthcare professional twice. Individuals are very reliant on their specialist nurse for conditions that have them. From the open-ended answers, we read a lot about the incredible value they bring to people. We know that access to specialist nurses can be very difficult due to the variability of provision between boards. Some of our members offer clinical services such as Scottish Huntington's Association, Cerebral Palsy Scotland, Quarriers, Revive MS Support and the MSA Trust are a few which work hard to provide specialist services to people across Scotland. Even more of our charity members are receiving lots of referrals from the NHS, from GPs and so on to provide support, but there's no funding to go with it. And demand is outstripping capacity at the moment. Here are some reflections based on the interrogation of both the qual and quant data for ways of making a difference for people with neurological conditions, starting with boosting awareness of what support is available and who is eligible, and providing more condition-specific information in print format. Many people don't know about or can't access digital services like Alice, Right Decisions or NHS Inform. Printed condition-specific information would also be great in GP waiting rooms, outpatient waiting rooms, and in A&E perhaps. A really big improvement would be if a single point of contact could be provided for people to help with getting appointments or for coordinating follow-up appointments. This would make a big difference, taking significant pressure off people, particularly those with comorbidities who have to see different specialists. Living with more than one condition can make treatment more difficult, and fragmented care often makes life very complicated. Moving on to the children and young people responses, due to the very low numbers of direct children and young people responses, which was 11, the findings from this section focus primarily on the perceptions of children and young people from the carer's perspective. The conditions represented here are cerebral palsy, epilepsy, autism, and FND. Neurological conditions cause significant barriers to independence and enjoying activities from the carer's perspective, with a significant proportion reporting very much or quite a lot of impact on being active, doing fun things, and completing daily tasks. However, it's worth noting that even though we had a very small number of children and young people respondents, their answers were much more upbeat, with only 18% saying their condition stopped them from doing fun things. The impact of conditions on children has a major impact on their parents and siblings too. Parents talk a lot about the exhaustion that comes from endlessly advocating for their child and having to fight for every possible source of help and support. The reality for the majority of children with a neurological condition is the frustration and anger that it causes for the experiences they lose out on, the impact on their family, the difficulty accessing the services, and pain that often accompanies their condition. We also asked children and their carers about satisfaction with medical and healthcare services. government-provided personal care and support services and mental health services, as well as perceptions of improvement over the past 12 months. For over half the sample, social support and mental health services are not meeting people's needs, but 40% said mental health services had improved over the last 12 months. Delays in accessing community support, home adaptations, access to day services and counselling are taking a toll on children and their carers. The polarised data on the benefits of counselling reinforce the qualitative data we have that waiting lists for CAMS are dangerously long, and those who are able to get into the system find it follows a one-size-fits-all approach without specialist knowledge of their neurological condition and with generic self-management approaches applied, which doesn't work for everyone. The majority agree that medical and healthcare services are meeting their needs, their child's needs, and perceptions of improvement to medical and healthcare services were shared by a third of respondents. That 24% of children and young people had needed 1 to 2 emergency hospital visits in the last 12 months, 9% had 3 to 5 visits over the last 12 months, might point to the lack of available treatment, care and support these children are getting, and perhaps the unpredictable nature of their condition. Looking at the UK data by condition, because we don't have sufficient numbers for Scotland data for CYP, these emergency hospital visits are mostly happening to kids awaiting diagnosis, as well as those with cerebral palsy, epilepsy and dystonia. A problematic area is around transitions, where 82% of children moving to adult services said they did not have a named worker. We asked about information on waiting times for 33 services, but we've excluded any service that had a base lower than 6. This is just to show you the range of services that children and young people access and where the longest waiting times are, which are shown by the lime green bar. The longest wait times shown here are for accessing community support, home adaptations and day services. Some reflections from the Children and Young People Survey relate to 4 main areas: provision of decent respite care and day services for children and young people, providing better support for children with neurological conditions in schools, including condition-specific information for teachers. We've got a leaflet we can share with people which explains all the common symptoms of neurological conditions. Develop a more targeted mental health support to enable children to benefit from a referral to CAMS and cut down on waiting lists. And finally, ensure that children moving to adult services have a named worker, and for conditions which have no adult services like cerebral palsy, ensure that families and children have information to what support is available in their area, information about grants that fund this support for those who are eligible, and pointing people to peer support, which we know is invaluable. This is our final section on the carers. 1/5 of carers were looking after someone with people with epilepsy, and just under 1/5 were looking after someone with cerebral palsy. Carers say the biggest impacts of the neurological condition on the person they care for are on movement, thinking and memory, and sleep. The first theme that comes out of the survey is that most carers are not coping well. This is due to a number of factors: the intensity of the hours spent caring, which is more than 50 hours a week for the majority of respondents. Lots of carers are caring for more than one person, the loss of their own career or education, or a reduction in working hours, which leads to financial strain and difficulties. Lots of carers have physical conditions themselves, with only 1/3 saying they had no illnesses at all. Access to social work is getting harder, and the eligibility criteria seems to be that once someone can't cope, then the state will start to offer support. This is obviously leading to people burning out and not managing well at all. Carers of children and young people talk about the battles keeping their child in school, raising awareness of their condition with teachers, the limited information available for teachers about different conditions, and having to move to homeschooling, as a result of inadequate measures being put in place. Disability is expensive, and many neurological conditions cause moderate to severe levels of disability. However, due to the complex and around-the-clock needs of the person they care for, many carers have had to reduce their working hours, leave their jobs, and cut back on expenses. At the same time, some carers have had to stay in full-time work to pay for housing adaptations and equipment because they can't afford not to. Caring comes at a huge personal cost, with the majority of carers having to give up on pursuing their own educational work opportunities to manage their caring obligations. From the open-endeds, we can see this was accepted with no resentment, but carers are reaching burnout from the physical exhaustion as well as the mental load. This is a well-educated sample with 47% of carers educated to university or postgrad level, and yet nearly half was surviving on a household income of below £35,000 a year. Only a quarter of carers receive sufficient financial support, and more can be done to inform people of the financial support they're entitled to. We've been struck by the emotional cost of caring and the fact that whilst the majority feel able to meet the day-to-day and health needs of the person they care for, very few feel confident and capable in their own lives. We also reported on the high level of comorbidities of carers, about a quarter of whom have a mental health condition as well, and just under half report a physical condition impacting mobility and strength. This has a big impact when trying to lift or move people. Those who find every day or regularly find every day challenging amounts to 41% of carer respondents. This is reflected in the open-ended answers, where we have read so many stories about people at breaking point. But this can be improved. We see that over half our respondents feel unsupported, and this refers to support from family and friends, employers, financial support, and support from the cared for person's healthcare team. More needs to be done across all these areas to improve life for carers. We know that a quarter of carers don't understand the financial support available to them. Many talk about having no time to wash their hair, let alone research eligibility criteria. This is something that carer centres offer, but of course many carers don't see themselves as such and may not have ever been into a carer centre. Those who talk about how much of a lifeline their carer centre is benefit so much from going. Looking at the barriers to providing care, lack of access to a healthcare professional who understands and can advise on the condition of the person being cared for comes out as a common issue affecting nearly half of respondents. Looking at the open-ended responses, frustrations range from people with epilepsy unable to speak with a specialist nurse about wanting to start a family, to carers of people with rare conditions like neurofibromatosis, for which there are no specialists in Scotland and who can't get any advice or answers. Other barriers are due to carers needing to work either full or part-time, and the financial constraints that come with the additional costs of disability and having to reduce working hours. We already know that over a third of carers live with a physical condition themselves, so it's no surprise that limited mobility and other health conditions impact their ability to care. Inadequate or no access to social care is also causing strain, with respondents being discharged with no notice following a short period of help from social care, to those who were given a bank card to pay for services but with no money put onto it, to fighting for care packages for children who can't move around.
Oh, Alice, I think you might have frozen. Is that the same for everyone else?
Homes or removed to more appropriate housing.
I think you're back. Sorry, Alice, you just froze for a second there.
Which slide are we on? Have you got to?
I think you were towards the end of your bullet points on 4 barriers to caring.
Okay.
Maybe if you could just recap those.
Yes. So looking at the barriers to providing care, back from there.
Yeah.
Okay, lack of access to a healthcare professional who understands and can advise on the condition of the person being cared for is a common issue that impacts nearly half of our respondents. And we can see frustrations from people with epilepsy who can't speak to a specialist nurse about wanting to start a family. There are also carers of people with rare conditions like neurofibromatosis, for which there are no specialists, and they therefore can't get any advice or answer any questions. Other barriers are due to carers needing to work full or part-time and the financial constraints that come with the additional cost of disability and having to had to reduce their working hours. We know that over a third of carers live with a physical condition themselves, so it's not a surprise that limited mobility and other health conditions impact their ability to care. Inadequate or no access to social care is causing strain, with respondents being discharged with no notice following a short period of help from social care, to those given a bank card to pay for services but with no money to put onto it, to those fighting for care packages for children who can't move around independently at home and being told there is no money for items like riser recliners. Finally, lots of people are fighting to access housing adaptations or a move to more appropriate housing. Hoists are not being delivered in time, and people in council housing are struggling to pay for their own ramps and wet rooms. Finally, some reflections from our carer survey. It's no surprise to anyone that carers need respite, better mental health support, and to have awareness of availability and eligibility of financial and peer support, better access to housing adaptations, and ideally a more joined up health and social care sector where everyone is on the same page from the get-go. Thank you for listening. Let's end the recording here. I'm going to stop my screen now and we can move to questions.